What if one of the biggest hormone myths in women's health is not just wrong, but actually hurting millions of women? Let me tell you a story. A 57-year-old woman came into surgery for a mastectomy, and before she went under, she was crying. She believed her cancer was her fault because she had been on hormone replacement therapy, and her doctor told her that HRT caused her cancer. Now imagine carrying that kind of guilt into surgery. She woke up in terrible pain, and I believe the emotional stress she felt before surgery may have played a role in how intense that pain became. Her acute pain turned into chronic pain, and she still deals with it today. No one can know that for sure. But what I do know is this: bad information can hurt people. And in women's health, hormone myths can lead to real harm. That woman is one of the reasons I became so passionate about women's health. I wanted to help clear up these dangerous ideas and give women the full picture. So today, let's talk about the 3 biggest hormone replacement therapy myths that need to go away. We'll cover the myth that hormones cause breast cancer, the myth that natural hormone decline should just be ignored, and the myth that hormone replacement causes heart attacks and strokes. Let's get into it. Myth 1. Hormone replacement always causes breast cancer. This myth started spreading more than 20 years ago after the Women's Health Initiative. A lot of people came away thinking all hormone replacement therapy causes breast cancer. But that is not what the full picture shows. In fact, that study found something very different in women who took estrogen only. They actually had lower breast cancer rates. And this has been backed up by later research too. One meta-analysis of randomized controlled trials looked at more than 14,000 women and again found that estrogen-only hormone replacement therapy reduced breast cancer risk. That does not mean estrogen is right for every woman. It means the story is more nuanced than hormones are dangerous. Now here's the important part: if a woman has a uterus, estrogen usually needs to be balanced with progesterone to protect the uterus and support bone and neurological health. That is why most of my patients take both estrogen and progesterone. But not all progesterone is the same. The risk seems to be higher with synthetic progesterones, also called progestins. That does not look to be the same with bioidentical progesterone, which is chemically identical to the hormone the body makes. That difference matters. For example, the E3N cohort study from France found that synthetic progestins may increase breast cancer risk, while bioidentical progesterone may actually lower that risk. That same pattern has been seen again in later work. There is also the famous Finnish study showing reduced breast cancer mortality in women using hormone replacement therapy compared with women not using hormones. And a systematic review looking at more than 86,000 women found that bioidentical hormones were linked with a lower breast cancer risk than synthetic hormones like progestins. A lot of patients are surprised when I explain that birth control uses synthetic hormones. Those are not the same as the hormones your body naturally makes, and that distinction matters when we talk about risk. I am not saying all synthetic hormones are bad. I am saying we need to be precise. For many women, especially those dealing with PMS, PMDD, perimenopause, or menopause symptoms, bioidentical hormone replacement therapy may be a better fit. One important caution: many of these studies are observational, not randomized controlled trials. So there is still debate about the ideal hormone protocol. But we also should not ignore the risks of leaving women untreated. That leads to myth number 2. Myth 2. Natural hormone decline does not need treatment. A lot of women hear this and think, if it's natural, maybe I should just leave it alone. But natural does not always mean harmless. And it definitely does not always mean optimal. Think about other age-related changes. People lose muscle mass, bone density, and vision as they get older. Just because something happens naturally does not mean we should ignore it. You would not tell someone to just live with osteoporosis, diabetes, or high blood pressure because those conditions can happen as we age. We treat them because doing nothing can lead to pain, disability, and a shorter life. The same logic applies to hormone deficiency. Symptoms like hot flashes, sleep problems, brain fog, and quality of life loss are not small issues. They matter. And hot flashes are not just annoying. They may actually affect heart health. During a hot flash, your fight or flight system, also called the sympathetic nervous system, gets activated even though you are not in danger. That puts stress on the body. And chronic stress is known to be hard on blood pressure, blood sugar, and the heart. Research shows that hot flashes can raise sympathetic tone and may contribute to high blood pressure, insulin resistance, and other heart disease risk factors. In fact, the worse the hot flashes, the higher the future risk of heart disease seems to be. Some people describe each hot flash as a tiny injury to the heart and blood vessels. And while that may sound dramatic, it helps explain why these symptoms should not be dismissed. Hot flashes may also lower heart rate variability, or HRV. HRV is one way to measure how much the fight or flight system is active. The more severe the hot flashes, the more depressed the HRV may become, and the higher the heart disease risk may be. Menopause is also linked with other changes that matter, including insulin resistance, weight gain, and increased inflammatory markers. All of that can add up over time. So if a hormone deficiency is affecting a woman's health, energy, sleep, mood, or heart, why would we ignore it just because it is natural? That brings us to the third myth. Myth 3. Hormone replacement causes heart attacks and strokes. This myth has a little more nuance, and that matters. Low estradiol levels have been linked to worse heart health outcomes, and hormone replacement therapy may reduce heart-related death in some women. One well-known study from Denmark found that women taking hormones had 50% lower death from heart attacks compared with women not taking hormones. But here is where timing matters. When women start hormone therapy later in life, the risk of cardiovascular problems may go up. But when women start hormone replacement therapy before age 60 or within 10 years of menopause, many of the risks appear to go down. This is often called the timing hypothesis. And it makes sense. If hot flashes and other menopause symptoms are creating ongoing stress on the cardiovascular system, then waiting too long may allow more damage to build up. But if hormones are started earlier, before that damage grows, the outcome may be better. Some experts believe starting hormones too late could destabilize plaque in the blood vessels, which may increase stroke risk. So the real message is not, hormones are good, or hormones are bad. The real message is that timing, patient selection, and proper guidance matter. That is why so many women should not be denied estradiol replacement therapy during the window when it may help most. And even if hormone replacement therapy did not prevent heart attacks, it still might improve sleep, hot flashes, mood, irritability, and overall quality of life. That counts. Women deserve care that looks at the whole picture, not just fear-based headlines. Yes, hormone replacement therapy has real risks. I am not pretending otherwise. Some studies do suggest caution, and every woman's situation is different. But when treatment is guided by a hormone specialist, the risks are often low, and in many cases may be lower than the risks of leaving symptoms untreated. Final takeaway. So here is the big lesson. Hormone replacement therapy is not one size fits all. The myths that all hormones cause breast cancer, that natural decline should be ignored, and that HRT always causes heart attacks or strokes are too simple and often misleading. The truth is more nuanced. For the right woman, at the right time, with the right guidance, hormone replacement therapy may protect health, improve quality of life, and help women feel better as they age. If this helped you understand hormones better, share it with someone you care about. And if you want to keep learning, make sure you check out my other video on testosterone in women too.
Thanks for watching Vitality Health Works. Small, science-backed habits build lasting health. Start today. If this helped, like and subscribe and turn on notifications. See you in the next video.